Have you ever wondered what a mammogram is, or why you might need one? Does the breast screening program actually work? Do mammograms really save lives? Or maybe you've been scared by the videos from idiots online telling you that they're dangerous and they don't work. Today, I'm going to tell you everything you need to know about mammograms and breast screening. I'll tell you how they work, why you need one, and how the breast screening program saves lives. I'll also tell you if they hurt, what to wear when you have one, and reassure you that they are completely safe. And if you've still got a question about it at the end of the video, send me a comment and I'll get back to you. If you've not watched one of my videos before, hi, I'm Dr. Liz Reardon. I'm a breast surgeon who's had breast cancer 3 times, so I know what I'm talking about. And I do the research so you don't have to. So what is a mammogram? Well, it's a low-dose X-ray of the breast, and it's made up of 4 scans or views, 2 of each breast. 1 looking at your breast from top to bottom, and 1 looking at it from side to side. I'm then trained to look at the 2 images and create a 3D picture of your breast in my head so I can work out exactly in your breast where a cancer is. And it's currently the only test proven to reduce deaths from breast cancer. So what happens when you have a mammogram? Well, firstly, all mammograms are done by female mammographers. They will tell you exactly what to do, so don't worry if you're nervous. Firstly, you'll be asked to stand facing the mammogram machine, and don't worry, they'll put you in the right position. You'll then be asked to position your right or left arm over the top of the stand, a bit like you're hugging it. The mammographer will then place your breast on the X-ray plate, and a glass clear plastic plate is lowered on top of your breast to flatten it, spreading it as thinly as possible so it's easier for the X-rays to travel through your breast tissue. The scan itself takes a couple of seconds, and then the mammographer will come back and she will move the machine and we will take the side view of your breast. Once that's done, we'll then go to the other breast and we'll take the 2 views of that side. The whole thing takes about 5 minutes in total, and the appointment shouldn't take more than half an hour. So when should you have a mammogram? Well, there are 3 reasons. 1 is if you notice a change in your breast and you're seen in a breast clinic. If you're 35 to 40 or older, you will have a mammogram as part of your visit and you will get the results on the same day. The second reason is part of your breast cancer follow-up to look for a recurrence in your breast or a new cancer on the other side. And the third is when you go for breast screening. This starts at the age of 40 or 50, depending on where you live, and it carries on until you reach your 70s. We do mammograms because your risk of getting breast cancer goes up as you get older. When you're 40, only 1 in 64 women will have breast cancer, but when you're 70, that number goes up to 1 in 25 women. More on breast screening later. Do mammograms hurt? Now, I was worried about this before I had my first one. Most of my breast cancer ladies told me it didn't hurt, but I was still scared, and I'm a breast surgeon, and I'll be honest with you, it did make my eyes water for a second or 2. I had very dense breasts, and it was quite a tight pinch, but it only lasted for about 20 to 30 seconds in total. And as my breasts have got less dense due to my breast cancer treatment, and you can watch this video to find out more, the mammograms didn't hurt as much. What should you wear for a mammogram? Well, because a mammogram scans your breasts, you do need to strip off from the waist up. So you might find it easier to wear a skirt or trousers instead of a dress or a jumpsuit. Some screening units will have a changing room and you're given a gown to wear, whereas in others you may strip off and put your clothes on a chair by the side of the mammogram machine. Do mammograms cause breast cancer by bruising the tissue? No, they don't. This is a myth. It takes 5 to 10 years for one microscopic breast cancer cell to become a lump you can feel. And it's the same with breast trauma, like a car accident when your breast is bruised by the seatbelt. This doesn't cause breast cancer either. Can you wear deodorant when you have a mammogram? Now, I always get a bit anxious before my scans, and even though I'm a doctor, I still get embarrassed, and I don't want to be there with sweaty armpits. I just feel uncomfortable. However, it's really important that you don't wear a spray-on deodorant or antiperspirant or use talcum powder before the scan. And that's because the chemicals in those sprays and talc can show up as white spots on the edge of the breast, and that's what a breast cancer looks like. But a simple roll-on deodorant is absolutely fine, and it's got nothing to do with deodorants being dangerous. You can check out this video to hear more on that. Can you have a mammogram if you've got breast implants? Well, if you've had your breasts enlarged with implants, like a boob job, then you need to let your screening department know. That's because they need to use special paddles to scan your breasts, and you may need to have your mammogram done in a hospital or breast centre instead of a mobile van. Can you have a mammogram if you use a wheelchair? Well, yes, you can. But again, the mobile units that you often see in supermarkets might not be accessible, so it's best to ring your breast screening department and find out where the best place for you to have your scan is. You can stay in your chair to have them done. Do you still need a mammogram if you've had a mastectomy? I get asked this a lot, and no, you don't. And that's because your breast surgeon has removed all your breast tissue, so there isn't anything left to scan. What about 3D mammograms? Why don't I get one of those? Well, in the last few years, a newer type of mammogram has been developed, and it's called digital breast tomosynthesis, or 3D mammogram for short. Now, it's not available in all breast imaging centres. There are several studies that have shown it does lower the chance of getting a false callback, and it is slightly better at finding cancers in dense breasts. But it does cost more if you live in America, and it also takes longer to do. Whilst your breast is being squeezed between the two plates, instead of one picture being taken, a scan is taken from left to right of your breast to generate a 3D picture. However, the amount of radiation you get from a 3D mammogram is almost the same as a normal 2D one. It just depends on how dense your breasts are. There's not enough evidence at the moment to say whether 3D mammograms are better at saving lives than the normal 2D mammograms, and that's why your centre may routinely just use the 2D mammogram for breast screening. I hope that's answered all your questions about mammograms and breast screening. If you've got any more, let me know in the comments and I'll get back to you. Remember to subscribe so you don't miss my next video. I'm Dr. Liz O'Riordan, and thanks for watching.